To begin, I'll briefly go over the instruments needed when recording resting blood pressure. You will need a blood pressure cuff, manometer, and a stethoscope. First important step is that the patient must be seated quietly for at least 5 minutes in a relaxed state, with her feet flat on the floor and their arms supported at heart level, meaning arms on the table with palms facing upward. Patients should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. To begin, make sure the appropriate cuff size is being used. The bladder within the cuff should encircle at least 80% of the upper arm. Many adults require a large adult cuff. This will guarantee in getting more appropriate and precise measurements. Then identify the artery mark on the blood pressure cuff, aligning the artery mark with the patient's brachial artery, which is located in the continuation of the axillary artery on the inside of the arm next to the elbow. Then you have to make sure that the prongs of the stethoscope are facing outward in order to get better hearing. To double check, gently tap the chest piece of the stethoscope. Gently palpate the patient's arm to locate the brachial artery. Place the stethoscope chest piece below the antecubital space over the brachial artery. And quickly inflate the cuff pressure to 200 millimeters of mercury. Once the cuff pressure reaches 200 millimeters of mercury, slowly release the pressure at a rate equal to 2 to 5 millimeters of mercury. Next, listen to Coral-Crofts sounds that are separated to 5 different phases. The first phase, being the systolic blood pressure reading, is the initial sound of the onset of sounds. The fifth phase is the complete disappearance of sounds, which would be diastolic blood pressure. Blood pressure readings for this client was 110/80 millimeters per mercury, which is considered normal. The norms are represented in the following table for resting blood pressure for those that are 18 years and older. And using these norms, individuals shouldn't be taking any hypertensive medication and should not be acutely ill. During the measurement, when systolic blood pressure and diastolic blood pressure fall into 2 different classifications. The higher classification should be selected. This classification should be based on 2 or more readings, taken at each of 2 or more visits after initial blood pressure. Screening, generally, these norms are visited periodically. It is generally recommended that all people older than 30 years old have their blood pressure checked annually.